Aortic dissection. An aortic dissection is a genuine condition where the inward layer of the aorta, the huge vein expanding the heart, tears. Blood floods through the tear, causing the internal and center layers of the aorta to isolate, analyze. In the event that the blood-filled channel cracks through the external aortic divider, aortic dissection is regularly deadly. Aortic dissection is moderately unprecedented. The condition most habitually happens in men in their 60s and 70s. Side effects of aortic dissection may emulate those of different sicknesses, frequently prompting delays in analysis. Notwithstanding, when an aortic dissection is distinguished early and treated immediately, the possibility of endurance extraordinarily improves. Side effects. Aortic dissection side effects might be like those of other heart issues, for example, a respiratory failure. Regular signs and indications include unexpected extreme chest or upper back torment, regularly depicted as a tearing or shearing sensation that emanates to the neck or down the back. Unexpected extreme stomach torment. Loss of awareness. Windedness. Unexpected trouble talking, loss of vision, shortcoming or loss of motion of one side of your body, like those of a stroke. Feeble heartbeat in one arm or thigh contrasted in the other. Leg torment. Trouble strolling. Leg loss of motion. When to see a specialist. In the event that you have signs or manifestations, for example, serious chest torment, blacking out, unexpected beginning of windedness or indications of a stroke, call 911 or crisis clinical help. These signs and side effects don't generally show a significant issue, yet it's ideal to get checked rapidly. Early discovery and treatment may assist with saving your life. Causes. An aortic dissection happens in a debilitated space of the aortic divider. Persistent hypertension may pressure the aortic tissue, making it more defenseless to tearing. You can likewise be brought into the world with a condition related with a debilitated and augmented aorta, like Marfan disorder, bicuspid aortic valve or other more uncommon conditions related with debilitating of the dividers of the veins. Infrequently, aortic dissections are brought about by horrible injury to the chest region, for example, during engine vehicle mishaps. Aortic dissections are isolated into two gatherings, contingent upon what portion of the aorta is influenced. Type A. This more normal and perilous sort includes a tear in the piece of the aorta where it leaves the heart or a tear in the upper aorta, climbing aorta, which may reach out into the midsection. Type B. This includes a tear in the lower aorta in particular, dropping aorta, which may likewise reach out into the mid-region. Hazard factors. Hazard factors for aortic dissection include uncontrolled hypertension, solidifying of the supply routes, atherosclerosis, debilitated and protruding conduit, prior aortic aneurysm, an aortic valve imperfection, bicuspid aortic valve, a narrowing of the aorta upon entering the world, aortic coarctation. Certain hereditary infections increment the danger of having an aortic dissection, including Turner's condition. Hypertension, heart issues and various other medical issues may result from this issue. Marfan condition. This is a condition wherein connective tissue, which upholds different designs in the body, is powerless. Individuals with this problem regularly have a family background of aneurysms of the aorta and other veins or family background of aortic dissections. Other connective tissue issues. This incorporates Ehlers-Danlos condition, a gathering of connective tissue problems described by skin that wounds or tears effectively, free joints and delicate veins and Loeys-Dietz disorder, with contorted supply routes, particularly in the neck. Provocative or irresistible conditions. These may incorporate Goliath cell arteritis, which is an irritation of the veins, and syphilis, a physically sent contamination. Other potential danger factors include sex. Men have about twofold the rate of aortic dissection. Age. The rate of aortic dissection tops during the 60s and 80s. Cocaine use. This medication might be a danger factor for aortic dissection since it briefly raises circulatory strain. Pregnancy. Rarely, aortic dissections happen in any case solid ladies during pregnancy. Focused energy weightlifting. This and other demanding obstruction preparing may expand the danger of aortic dissection by expanding pulse during the movement. Difficulties. An aortic dissection can prompt passing because of extreme interior dying. Organ harm, like kidney disappointment or dangerous intestinal harm. Stroke. Aortic valve harm, aortic disgorging, or break into the coating around the heart, cardiovascular tamponade. Counteraction. Here are a couple of tips to diminish your danger of an aortic dissection. Control circulatory strain. On the off chance that you have hypertension, get a home pulse estimating gadget to help you screen your circulatory strain. Try not to smoke. In the event that you do smoke, find ways to stop. Keep an optimal weight. Follow a low-salt eating routine with a lot of organic products, vegetables and entire grains, and exercise consistently. Wear a safety belt. This decreases the danger of horrendous injury to your chest region. Work with your PCP. On the off chance that you have a family background of aortic dissection, a connective tissue problem or a bicuspid aortic valve, tell your PCP. On the off chance that you have an aortic aneurysm, discover how frequently you need observing and if medical procedure is important to fix your aneurysm. In the event that you have a hereditary condition that builds your danger of aortic dissection, your PCP may suggest prescriptions, regardless of whether your circulatory strain is ordinary.